I get compliments every day on my smile, and no one knows that you have got implants. I had spent many years since the age of 15 wearing an upper partial. The teeth surrounding the partial were no longer in good condition, breaking from root canals and things like that. And I was really unable to eat and live a comfortable lifestyle. I chose New Teeth Now because I definitely wanted to have a place where everything was done the same day, with the same team of doctors, in the same facility, and someone who's been doing this for many years and only this. Dr. Richards is one of those people that do this and nothing else. From the full consult to the meeting of the surgeon to the actual surgery day. New Teeth Now offers you everything that you need. There was no pain for me whatsoever. I think that we suffer more pain prior to surgery with toothaches and open root canals and exposure to hot and cold things that we eat and drink. No more adhesives, no more removing your teeth, no more hiding your smile. It's really about how you feel. I'm not tired, I'm not run down. I feel more youthful than I have felt in years. All with a brand new smile that people always compliment me on. Know that it can all be possible. It can happen. It's the best thing you could do for yourself.
Wow, that transformation is beautiful. Great job, Doc. Alrighty, well, hello everyone. Welcome to our webinar tonight.
Yeah.
Thanks for joining us. Today I have Dr. Richards with me.
Hello, guys.
Yep, and we're about to dive into all things dental implants. So let's get started. Before we begin, there is a QR code that's on the screen. You guys can scan it to go ahead and schedule for a virtual consult if you don't have the time to schedule initially for an in-person consult. It's a great way to just get a lot of information before you fully commit if you're not quite there yet. If you have any other additional questions tonight, we will have Lisa. She is one of our amazing phone coordinators. She will be on the line to answer any questions you have and also to schedule you for an in-person consult if you would like. If you have any questions that you want us to clarify later on through the webinar, drop a question in the YouTube chat and then we'll get that answered for you. Alrighty.
So we're looking at a set of upper teeth. This would be a screw retained set of teeth, usually on 6 implants that are placed under general anesthesia. Typically, we'll be covering all of that as we move through the presentation here. And this would be similar to a fixed bridge. The difference between the hybrid and the fixed bridge is that a lot of people who come in with these types of who want these types of teeth have significant bone loss from periodontal disease, or they may have been wearing a denture for 50 or 60 years, since their 20s. And so they've had a lot of bone loss. And in this picture, this is showing more of the crown and bridge type of concept where the implant and the teeth are in close proximity to one another. And this is not always the case. There are more than this particular type of example is where the implants go into where the bone is and the teeth have to be where the teeth need to be to support the upper lip and to look good. And we see that more with advanced periodontal bone loss and folks who have been wearing dentures for 30, 40, 50 years. And so the teeth need to be out to support the lip. They have to be way out beyond where the implants are in a lot of these situations. So the fixed means it does not come in and out. Upper is obvious. And the hybrid may mean where there's a disconnect between where the bone is and where the teeth are. If I'm using language that's too technical, please type it into Christine, and we'll try to back it down a little bit.
We'll take it to layman's terms.
This is an example of the lower, basically the same thing on the lower, where the teeth are screw retained to those silver pieces. Those silver pieces, the term for those is the abutment. And you'll also note that there's gum tissue, which would be artificial gum tissue, and the amount of artificial gum tissue is directly related to how much bone loss there is. So the greater the bone loss, the more artificial gum tissue is present, and the other way as well. But fixed means it doesn't come in and out. The lower is obvious, and the hybrid, where it may be where the implants and the teeth are in close proximity, or the implants and the teeth may be displaced from one another.
Gotcha. Perfect way to go through it, Doc. We do have two great questions that came in, and it's actually questions that I can answer for you. So, what is the initial consultation process? So we'll dive deep into the details of that later on, but with the initial consultation, it's about an hour and a half. You sit down with your implant coordinator. That implant coordinator will be your go-to person from start to finish. You'll never be, in our practice, you'll never be bounced around to multiple other people to answer your questions. We really try to give you a direct line of communication for clarity and standard of care. In terms of the consult, it's hour and a half. You sit with a coordinator, a CT scan is taken, you'll meet Dr. Richards, he'll go over your CT scan with you, and you leave with your treatment plan and also the cost of your treatment. So that is the consultation process. In a quick snippet, we'll dive deep into it later on. I hope that answers your question. And then the second question that we have is that this patient wants to know, Doc, when I'm very nervous or emotional, I automatically switch back to my native language, Spanish. Is there anyone there that would be able to translate as needed?
Yes, we have two people who are fluent, and there wouldn't be a problem at all. No problem.
Yep. We'll make sure you're comfortable and everything is clear as you can.
Yeah, and that would be during the consult, absolutely no problem whatsoever. If you make a decision to have the procedure, of course, you're asleep, and therefore you're not going to be awake and talking and that kind of thing. So, but yeah, we do have folks that can take care of that translation for sure.
Yes, not a problem at all. All right, so let's jump into our next slide.
Do you want me to cover that, or you want to do it?
I can do it, Doc. What do you
All
want?
right, go ahead.
Yeah. Okay,
Go ahead.
So now if at this point, if you're wondering what would a day of surgery at New Teeth Now look like for me, it starts out with you'll be under general anesthesia for the whole entire procedure. We like to joke around that none of our patients would like to be awake for this. You want to be fully knocked out. And some of our patients said it's the best sleep they've ever gotten. But it's just to make sure that your airways are fully protected, we have full control over it, and that it's the most safe way to do this entire procedure. After so many years of Dr. Richards doing this, that is what we have come to realize. The second step is that once you're comfortable and asleep, we'll start to remove any teeth. If you have any teeth, you'll be given antibiotics intravenously. Any presence of infection and like that will also be removed at that time period. And then by the time you wake up, implants have already been placed. And then while you're comfortably recovering from waking up from the surgery, you'll be with one of Dr. Richards' assistant the entire time just to make sure that you're fully comfortable and you're safe while your teeth are being modified to exactly where the implants were placed during surgery. And then after that, the teeth are placed in your mouth and Dr. Richards will do the necessary adjustments with your bite to make sure that you are in that perfect bite that we need you to be in, and then you leave that day with implant retained teeth. So that is what a surgery day will look like at New Teeth Now.
Let me just comment about
Yeah, of
number
course.
one real quick.
Go for it.
I don't want the viewers to think that the surgeon does the anesthesia. Okay, we have nurse anesthetists who deliver the anesthesia. And so these are RNs who do 3 or 4 years of anesthesia training after they become an RN. And we have a group that rotates through our office. They also have jobs in outpatient surgery centers and hospitals, and they rotate through our outpatient surgery center. And so these are highly experienced nurse anesthetists who deliver the anesthesia and who are sitting right at your head through the entire procedure. Okay.
Everything is done all in one day, all in one office. This is something that we are really proud of at New Teeth Now, that we are able to offer to our patients. All of our surgeons are in-house and all of our surgeons are board certified, which again, we'll dive deep into why that's important later on. Our restorative doctors are in-house. They are located on the second floor of our outpatient center, and then we also have our dental lab. So in comparison to maybe some other practices or centers that may offer the same procedure as we do, some of them do not have their own dental lab, and there's they could be sending out your case to somewhere else.
Sure.
It could be in the same state, it could be local, or it could be maybe in another state or even another country. And so here at New Teeth Now, we never want to be in the position where we have to tell you that your teeth aren't ready, and you have to go so many days without teeth until the lab somewhere else gets it back to us. So by us having our own in-house lab, we are able to handle anything that doesn't fit properly, needs modifications, so that you can leave with your teeth the same day. So, and everyone communicates together, and it's
Yep.
really streamlined, and like everyone is on the same page, which is so nice.
Yeah, it's very nice.
Oh, it looks like we have another question that came in. So how long do I keep the temporary teeth in?
Well, that's depending on what you call temporary. So typically on the day of the procedure, a person leaves, as Christine said, with a set of teeth screw retained onto the implants. Those teeth are printed. They are 3D printed. Now, when we put those in, I adjust the bite and we rescan everything, and we look at the person carefully from the front, and we look at the midline of the 2 front teeth, and we look at the relationship. We look at everything and to see how it looks. And now this is the afternoon of the surgery. So we look at all of that. We look at how the teeth look in the patient's mouth and face, and then we write up a lab order to go to our designer to fabricate the zirconia teeth. At your first checkup visit, which is typically about 2 weeks, we take the printed teeth out and we put the zirconia, the first set of zirconia teeth, go into your mouth at your first checkup visit. That is about 2 weeks after the procedure. Now, we do call them temporary, but they are zirconia. They're the same material that the final teeth are made out of. But there are a couple of things that need to happen. First of all, you need to be on a soft diet to allow the implants to heal. And second of all, we want any shrinkage that's going to occur around the gums, we want that to go ahead and happen. We want any shrinkage to go ahead and shrink. We want to see over a period of, say, 5 months. We want everything to shrink. And we'd like, if there's going to be any little gaps that open up between the teeth and the gums, we want them to open up. Then, at that point in the future, 4 or 5 months out in the future, we do new digital scans. We take the teeth out and we scan the teeth, scan the bite, and we make the final zirconia teeth. which we insert at about, if you're going to heal 4 or 5 months, typically by 6 months, a person is getting the final zirconia teeth. So, it just depends on what you call temporary. I guess the printed teeth are temporary. You wear them about 2 weeks. The first set of zirconia goes in. Are they temporary? Yes. Soft diet. We want the shrinkage to occur in the gums. And then once things are healed, we do the final zirconia. So you're in really good teeth through the entire healing process, except for the first 2 weeks. You're in zirconia teeth. If you want to call them temporary zirconia, you can go ahead and call them that. But they are exactly like the final teeth, except for the gum shrinkage and eating a soft diet.
Yes, exactly.
So, anyway, I hope that answers that. I was a little wordy with that, but that's a very important
It's
point.
so important.
Yeah.
It's like
To understand how we do things. I think we do things very different
exactly
than most people.
I agree, Dr. Richards. I think sometimes patients come to us, and the question does come up of, I went to so-and-so place, they're only giving me 1 set of teeth, how come you guys are giving me 3 sets? Or, and it's so imperative because
Yeah.
if you leave that day with that first set of teeth, you're not going to be happy at the end of 6 months because you'll have that gap,
Yeah.
It's unesthetically appealing and it's a bacteria
Yeah.
trap. So
The other
So
thing
important.
is some places have people wear dentures for 6 weeks. And, we have never done that. And that is truly, in this day and age, that is so far
Behind.
below the standard
Yes.
of care that it's just, you shouldn't have to do that.
yes. So always ask, how many sets of teeth you're going to have at the end because you want changes. That first set
Yeah.
of teeth that you chose, you might not love it. Maybe you want the shade to be brighter. Maybe you chose a shade that was too dark and you're like, maybe I can have a brighter smile, after a few months,
Well,
and you can make those
what
changes.
you're talking about now brings up another
Yeah.
really good point, because when you're wearing that first set of zirconia teeth and you wear them for, let's just say, 5 months. So during that 5 months, you've been test driving that car. And you've been looking at the color, your wife's been looking at the color, your best girlfriend's been looking at the color, or the size, or the shape of the teeth, or how the teeth are sitting under your lip. But your friends and your spouse have been looking at all of these things. Now, when you're transitioning from that first set of zirconia to the second set of your zirconia, you have the opportunity to make changes. And so that is also unique in the field. So, if there's some little something that's been bothering you, you get it fixed.
Exactly.
So,
Because I think otherwise, I think there are some places where, if you change your mind 6 months later, there is a charge.
Yeah.
And, so with our practice, we're really transparent about our price, and the price that you pay at the beginning is the price till the very end. So let's jump on to the next slide. Alrighty, location. Oh, let's see if it changed.
Yeah, we
There we
looked
are.
at that.
We are located in Lakeland, Florida. It's a wonderful little place, almost I would say Central Florida.
Very centrally located, right?
We have patients traveling from all over 50 states now, so we are pretty proud of that we have patients from not only the whole entire U.S., we also have patients coming to us internationally. So our team is equipped to help you if you are out of state or if you are traveling from another town. If you need accommodations, we do have hotel discounts and hotel blocks, and also if you need a driver to take you to and from, if you don't drive, or if you're coming just by yourself, we can also help accommodate that as well. That's just a conversation that you would have with our implant coordinator during the time of your consultation.
And we can also make special concessions with the lab to get things done to match your time schedule.
Exactly. These are our 2 surgeons in Lakeland. Of course, you have Dr. Richards and then his partner, Dr. Kirkpatrick.
Right.
Doc, I'll hand hand this over to you.
So this is just a simple X-ray, an X-ray that we would call a panoramic view. And this would be a traditional implant procedure where in the upper jaw, that would be the top, there are 6 implants, which is usual and customary in our practice. And you can see the 4 in the front are straight and the 2 in the back are tilted, and that's to avoid the sinus. The other pieces that are sticking down are the abutments, and we use angled abutments to help straighten those tilted ones. Same situation in the lower. The 2 most rear implants, the one on the left rear and the right rear, are also tilted. They're tilted to avoid the nerve that comes out of the jaw, which supplies feeling to the lower lip and chin. And there are 5 implants there, and that's also typical.
Perfect. Thank you, Doc.
Yeah.
All right, we'll jump on to the next. So here is our zygomatic implants.
Right. So this is also very typical, probably equally as typical as what we just looked at. And in the upper jaw, which is the top, where those longer implants are, you can see the 4 traditional implants in the front, followed by, on the far right and the far left, what's called a zygomatic implant. In the lower, there's also tilted implants with a couple of short implants in the left and right posterior. Now that term, zygomatic, seems to always throw people for a loop. And the best way that I can straighten that out in easy terms is the lower jaw down here is called the mandible, the medical term, but that's the lower jaw. And the upper jaw up here, that's the maxilla, it's the upper jaw. And then you've got the nose, and that's called the nasal bones. And then you've got the cheeks, and those are the zygomatic bones. And so these implants go from the arch, the upper jaw arch, out to the cheekbone, zygomatic bone. So they go from the jawbone to the cheekbone. And these implants are very strong. They are very stable. They're the most stable, strong implants that we place. They're, we do so many of them. We do more than anybody in the country. And they're not scary. And I think most of our patients feel very comfortable with zygomatic implants. And that's typical. I just can't express to you how typical that layout right there is. Equally as typical as just all traditional.
Yep. And like by what Dr. Richards might mean, typical is typical in our practice. Typically, like zygomatic implants are not what most offices will see. Definitely not something that your general dentist will often see or do. And even then, we get referrals from oral surgeons all over the country. That they themselves don't place zygomatic implants and they're not comfortable with it. It definitely requires a lot of skill and a lot of practice. You're just working in an area and a site where normal dentists do not ever work in, and sometimes a lot of oral surgeons don't work in either.
We've been doing zygomatic implants since about 2006. So, well, let's move ahead.
Yeah, let's jump ahead. Alrighty, this is a diagram.
Is this a video?
Yeah, I think it's interactive. It should be
Yeah.
interactive.
Should be. That's a nice. Are we on? Our mics on?
I think, I think the mics are on. Yep, mics are on.
This is a very nice little visual. I could talk about that for 10 minutes.
I know you can, Doc. I'll give you a minute.
But that visual, I mean, it's not perfect, but it's really pretty good visual.
I think it's a great visual.
Yeah.
The zygoma bone there anchored in the cheekbone.
Yep.
You can see it from there. Patients can't feel it, right, Doc?
Right.
Yep. So,
Well, the other thing about zygomatics is that when you get into the situation where there's no bone in the back of the upper jaw, no bone. So what are your options? Your options are a bone graft in the sinus and waiting for a year, possibly a year, before implants could be used, possibly a year. And that is not without potential complications. Contrast that to zygomatic implants, which are placed up to the cheekbone, can attach teeth to them that day. No bone grafting. And so, what are you going to pick?
Exactly.
Are you going to pick bone grafting in your sinus and waiting for possibly a year? Or are you going to look for zygomatic implants, which are not bad for your sinus, that you can attach teeth to the same day? It's no choice.
Yeah, no choice. Easy question.
Easy.
Easy answer. Okay, perfect. Alrighty. Let's jump into our next slide.
Now, there are some people who have no bone in the back and no bone in the front. And so here we put zygomatic implants in the front and in the back. And this is a so-called quad zygoma. I think you as the viewers would be shocked if you knew how many of these we do. This is very routine.
Very routine.
And it works really well. And the teeth, for a person who gets a quad zygoma, this is one of those that I was talking about earlier, where there's significant bone loss. And so the teeth need to be out to support the lip, and the implants are back. And so this is one of those which kind of really makes it a hybrid type situation. But these are strong implants, and they work very well. And these folks, when they get this, they're coming into a situation where there isn't anything else. And they can get this in one day, and they have a set of teeth attached to the implants in one day. And it's unbelievable, really.
It really is.
Yeah,
I agree.
it really is.
Doc, we had a great question from Carlo. He wants to know, can people honestly safely eat apples, corn on macabre with no risk of breaking anything or dislodging an implant from the bone after this procedure?
Yes. Now, I'm not going to sit here and tell you there's never a problem with anything ever breaking or anything, okay? Because occasionally we do run into little issues, particularly with people who don't come in for regular yearly checkups. But if a person is coming in for regular yearly checkups and their teeth are removed and all of these screws that hold the abutments in are checked, and the teeth are checked, and the teeth are cleaned, and their teeth are put back in, and the bite is checked and adjusted as needed, it is extremely unusual to have a problem. Extremely unusual. So, but yes, you can eat anything you want to.
Alrighty, I'll jump into the next slide. This is Dr. Richards' team. These are the ladies that help make it happen.
They do.
They are here with Dr. Richards. They've been with him most of them have been with him for over 10 years, Doc. I would say.
And whoever asked the question about speaking Spanish earlier, if you are still with us, the young lady on the right, Marilette, is of Mexican descent, and she's fluent. We have one other gal that works for Dr. Kirkpatrick who speaks fluent Spanish as well.
Yes. So we are here to accommodate all of your needs, Carlo. Oh, and it looks like we have another question. How long does it take to start the procedure once everything is completed? Oh, do you mean in terms of, to specify that, to elaborate on that question, do you mean like
after the consult?
After the consult, or just wait for her to respond?
So, okay, so a person comes in for a consult. So if you're a 35-year-old healthy person, male or female, never had any heart problems, don't take any medicines to speak of, we don't have to get any kind of fancy medical clearance for anything, then after you would see me, you would see our dentist, you would have some digital scans, which our lab people would process, and you could probably have the procedure within 10 days of the consult with me. If you are a 65-year-old diabetic with high blood pressure, you had a stent done 10 years ago, and we need to get clearance from your primary care physician and also cardiology, get some labs, cardiogram, do all that, then it would depend on how quick you could get all the clearances. And let's say that your hemoglobin A1C from your diabetes comes back too high and they need to do something with your medication to get that lower, then, you know, I mean, it could be quick if all your labs are in order, or if your blood pressure is too high and it needs to be corrected, or your hemoglobin A1C is too high and it needs to be corrected, it could take 3 months. So, you know, all of that is sort of dependent on several factors. I hope that answers that.
I think it does. Alrighty, so our next slide, this is our restorative doctors that we were talking about in the beginning of the webinar. This is Dr. Nafala and then Dr. Elliot Dibbs.
Right.
They are phenomenal restorative doctors that have been working with us for very long. Dr. Dibbs used to have his own general practice, and Dr. Nafala still is a practicing dentist as well. They are the ones that help you design your teeth. You sit with them and you have a conversation with them of what your teeth and smile would look like. So they're there to help you along the way, and it's really great. Again, like we can't stress enough how nice it is to have our own doctors, like our own restorative doctors on site. You know, we're not having to communicate, you know, with someone else. You know, maybe we've never worked with them before, you know, like miscommunication and things like that. These doctors really know hybrids in and out.
And that's all they do.
Yeah.
Dibbs, that's all he does. Cave probably 50% restorative dentist in his own practice about a mile down the road. And the other, he's in our office. I think we have a video coming up from Dr. Dibbs. Maybe we have in the past.
Yes, we do.
And he will talk to you about his experience having the dental laboratory right there with him.
My name's Elliot Dibbs. I am one of the restorative doctors at New Teeth Now. I've been here for a little over 12 years now. I guess one way to look at it is sort of the surgeons are creating the foundation with the implants, and the restorative doctors are building the house on the foundation. One of the things that really sets New Teeth Now apart from the other offices that are doing full mouth implant reconstruction is that I have my own laboratory here on site that myself and the other restorative doctors are able to use, and this is absolutely invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of this as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood, and because of the emotional concerns that they have, we really have to spend the time with the patients. You cannot rush anything. I will show the patient the colors, I will review which ones are more natural looking or less natural looking, and the patient's going to make the decisions. They may want to change the aesthetics, they may not want to change the aesthetics, they may only want to change the color of the teeth. Whatever the case is, we're able to communicate that to the laboratory. I get emails daily from my designers that gives me a 3D design that I can review the new design and the changes that we made prior to the lab proceeding. So they're not going to move from my discussion with the patient and records gathering to a subsequent set of teeth without my approval of the design. It's something that's extraordinarily complicated that we just happen to make look pretty simple in most cases.
These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I just don't know of any other office that's like this.
Doctors, so great to hear from them. Okay, alrighty. This is a slide that is super important to us. Doctor, you want to talk about it?
Sure.
Yeah.
We have two sets of teeth that have been worn for approximately 5 years. On the top is zirconia, and on the bottom is the old style acrylic that was used somewhere around 2006. Zirconia kind of came in about 2006. And you know, the acrylic, you can see the wear, the stains, difficult cleaning and that sort of thing, as opposed to the zirconia, which is a glazed porcelain material, much more durable, much easier to clean. Mm-hmm. So zirconia has really been, a big milestone in these teeth to get away from the acrylic. And now, of course, we're dealing with printed teeth. Mm-hmm. We totally have gotten away from the old acrylics altogether. And we have, as we discussed earlier, we're really only putting our patients into printed teeth now for about 2 weeks and then going straight to zirconia. Yeah.
And the reason why we include this picture in the webinar is that it's really important that if you don't pick up too many things from our webinar today, this picture is really important in highlighting the importance of you asking, your consultations. If you're going to second opinions or third opinions, you really need to ask them, what is the material that your final teeth will be made from? Just because, Dr. Richards and our team has done this for so long, we've seen the wear and tear that acrylic teeth have. So they're not, ideally, if you take care of these teeth, this should last you a lifetime.
Really?
So the material of your teeth should reflect those implants and how long they should last. And so if you can just see by judging from that picture, both were worn in the mouth for 5 years, what the acrylic set looks like. So super important, make sure that you ask these offices, what will my final teeth be made from? So, it looks like we have another question. Carlos loves his strong black coffee. Will any staining be able to be removed when returning for checkups?
I like my black coffee too, Carlo. Sure. Now, you could get into a situation where the teeth had to be removed, and we have a kind of a mini steam cleaner, but staining can be removed. It may not all come off just easily with a toothbrush or an electric toothbrush, but we can get it off.
Exactly.
Yeah.
And then also, we have another question. May I call tomorrow for an initial consultation? You may, or you can call tonight. The choice is up to you.
Yeah.
Lisa is on the line. She's ready to take that phone call. So if you want to jump ahead and you're free, you definitely can call the number right on the screen, and Lisa will be more than happy to set you up a consultation with Dr. Richards, or you can also wait till tomorrow. Either or.
Okay. Nice.
Nice. And then this is our implant coordinators, the ladies that I told you that you would be seeing during your consultation. This is Shauna, Chastity, and Allie. All of our coordinators also have a clinical background as well, so they're more than equipped to assist you and get you through the process from start to finish.
Yeah, I'll make a couple of comments. Shauna worked in the surgical end of things for a number of years. Allie was one of my surgical assistants, and Chastity came from a general dentist who did a lot of this type of work. So all of these ladies are highly skilled in and doing what they do. And when typically when a person would come and sit with Shauna, Chastity, or Allie, they really kind of go through everything. It's almost amazing.
They're great.
I'll
They
come
really
I'll come into one of
are.
the consults and
Yeah.
I'll start talking about this, that, or the other, and they'll go, "Oh, Shauna already covered that," or "Oh, Allie already
Yeah,
covered that," or
exactly.
and it's like, why am I here?
Exactly.
So, but they are very well educated in this line of work. They are the ones that if you have medical issues, and what Christine told you earlier, once you're hooked up with one of these ladies, they are your person that takes you through the process. You don't get handed off to somebody else. That person is your lady. They are the ones who coordinate getting all of the medical clearances. Because we do everything under general anesthesia, we pretty much are getting medical clearances from the primary care provider or whichever, mostly it's primary care providers and cardiologists. These ladies manage all of that and get everything ready. And so they are an important person for us and an important person for you, and to help you move through the system and
Exactly.
get things done.
Yep. And then Carla, you mentioned earlier that you might get nervous or emotional, and
Yeah.
you're in a good spot. Our
Yeah.
coordinators are so kind, and it's a non-judgment zone,
Yeah.
and so they'll really help you and make sure that you're comfortable, to get through the procedure.
And I think what you said, non-judgmental, because there are a lot of people who come in and they're very embarrassed about the situation that they have let themselves get into. None of us are judgmental. We're here to fix that for you. And that's what we do. And so, if you're having high anxiety about your situation and you think you're going to be judged, and that's just not the case. We're very compassionate. These ladies are very compassionate. And, we're here to help move you out of the situation that you're in into a better place. And so that's our job, and that's what we do.
Yep. So no judgment at all. Come on
Yeah.
in. No need to be nervous, but if you are, we'll guide you through it.
Or embarrassed.
Yeah,
A lot of people
yeah.
are embarrassed.
Our surgeons, our practice, we see patients from referrals from all over
Yeah.
50 states. So
Yeah.
we see some crazy things. So you might not be the craziest thing we've seen in yet. So no worries on that. Alrighty, so moving on.
We might be the crazy
We
one.
might be the crazy one. I think so. I think you're right, Doc. You love teeth. You love looking at teeth. So you might be the crazy one.
I might.
Alrighty, so we jump into the next slide. This is the consultation we mentioned earlier. We take a CT scan. Again, we develop your treatment plan that Dr. Richards talked about. And to elaborate on the CT scan, Dr. Richards does go very in-depth. So by the end of your consult, you'll get to know how many implants, where the implants are, what is he thinking. It's really nice. You get to see him draw on the CT scan to show you your bone levels. So it is a very detailed consultation that we feel that you'll leave being very educated.
And then I think the word is educated. We are not into high pressure sales. Allie and Shauna and Chastity, they kind of introduce you to our process, and then one of the doctors is going to come in and we're going to spend quite a bit of time with you, and we're going to totally educate you about what the situation is, what we are able to do, what we are not able to do. And I'll talk to people until they tell me, look, I think I understand. And so I think education is a word.
I think it's so important.
Yeah.
I think as a consumer of anything, the most important part is the education aspect. Educational. But yeah, so that is the consult. And then jumping into, this is a treatment plan that we spoke earlier about. This is what Dr. Richards will go over with you. You get to really see everything, to see your mouth, and understand what is going on with your situation.
Yeah, the CT scan is nothing more than a camera. It would be like standing up above you and taking a picture looking down on you, taking a picture from the back looking forward, from the forward looking back, from the side, slicing you up like a loaf of bread down at the grocery store, and being able to look at slices. So it's the software that enables us to look at all this, and it gives us so much information, and then we can explain that to you about, how wide is the arch? How deep is the arch? And it's in such a clear method. The software is so clear that the folks that come in, they can really understand.
Yeah,
see.
every patient.
So it's very nice that people can understand what we're talking about.
Exactly.
Yeah.
And I think that's the best part of of knowing what you need, why you need it.
Right.
Exactly. And then moving forward, at this point, if you're wondering what would the New Teeth Now entire process would look like in a snapshot, this is the best diagram to explain that.
Now, you told that person earlier you were going to kind of get down into the consult thing.
We did.
So,
Okay, so here we are. All right, so the consult, as we discussed earlier, is that hour-and-a-half appointment. You meet your coordinator, you meet your surgeon, you leave with that treatment plan that is from everything from start to finish. And this is the best part about our practice that I would say is one of the really nice things is that let's say that with the treatment plan that you're given, sometimes like Dr. Richards, you're in surgery and your conditions are more favorable than what it looked like on the CT scan. He will go ahead and place that extra implant or two to give you a better, more stable foundation, and you'll never wake up with a charge. So we really stick to the fact that what you are quoted is what is the cost at the end. And then you also get that clearance that Dr. Richards talked about to take to your primary care and any other providers. And then if you decide to move forward, we move to the pre-op and the impressions appointment. That is typically done about 7 days before surgery. Again, that's pretty flexible, but the standard is it's about a week before your surgery. That's when you'll sit down with Dr. Dibbs or Dr. Nafala, and they'll go over with you your teeth, your shade, your shape. What would you like your smile to look like? You have autonomy of the shade and the shape. They have the control of making sure that you are in proper function and the correct bite. You'll sit down with your coordinator again for the pre-op. They'll go over with you all the details, the nitty-gritty of, what exactly everything will look like. What does your diet look specifically like for 6 months? It's typically the guideline that we use is anything you can cut with a plastic fork you can eat, and that's just a guideline for 6 months. After 6 months, the world is your oyster, but we just ask that you follow that soft food diet, and they'll help you come up with list of things that you can eat and guidelines to help make it easier for you. However you're paying for treatment that day, whether it's through one of the financing companies that we partner with, or maybe you're paying it on a credit card, debit card, check, whatever it is, that will also be processed on that day as well. Then we move forward to your surgery day. You arrive at about 7:30 in the morning. You leave that day with your teeth in the afternoon, and then you have a couple of post-ops afterwards. I would say that the initial post-op is about 10 days to about 10 days after. Then you have that 1 month out, and then just a few in between those 6 months. They are spread out pretty evenly, so it's not like you're having to come to Lakeland so often. We really do respect and value our patients' time, so any visits that you are having to come to us, they are necessary, but they are as few as they can be.
Normally on that,
Yes.
when they come in for that first checkup visit, and we put the first set of zirconia in,
Yes.
then the next visit is typically 2 months. So then, following that 2-month visit, the next visit is 2 months.
Yep.
And at that point, they're 4 months and 2
Yes.
weeks out. And so that second 2-month visit is typically with Nofala or Dibs, and they begin to talk about the final teeth, what you would like to do, and may even do some scans at that time and see if they could go straight from the first set of zirconia to the final set of zirconia. What I mean by that is if a person came in and they had been wearing that first set of zirconia and they said, you know, I want to change the size and the shape and the color and maybe move this and maybe go that way, then Dibs may make a prototype set of teeth for you to wear with changes, and then have you wear that for a while, and then come back and give it the thumbs up, and then go to the final teeth.
Yep.
So I think we are very, whatever you want to say, generous or,
We really are.
on that end, because, we want you to be happy.
Yes.
I mean, come on.
That is.
I mean, that's the way we get people to send other people
Yes,
to see us.
exactly.
If you're, what do they say? If you're unhappy, you'll tell 10 people about it, and if you're happy, you tell one. But anyway, we want you to be happy. And if we have to, spend a little bit extra time or make an extra set of teeth or whatever we have to do, that's what we do. And that's what we're all about.
Yes, and it's. I wish that more practices were like this.
Yeah.
I think I've heard sometimes patients come in to us and they're being charged for every change, every modification. Again, like back to that material that we were talking about when we had mentioned, the zirconia and the acrylic. Some places will give you the acrylic set of teeth, and if you want zirconia, there's an upcharge
It's a big
for it.
upcharge,
And it's
yeah.
a pretty big upcharge.
Yeah.
It's not just a few $100. It's usually a couple $1,000s. So again, just super important that you're asking those materials and you're
Right.
making sure you know
Right.
what exactly is included with your treatment plan. And then,
So you were back on that slide.
yes, let me go back to that slide.
And we were talking about post-ops,
Yes, final teeth.
and then we kind of talked about creating the final teeth
Yep.
and placing the finals.
Yeah, then we
So the total time span, then 6-7 months, something like
yeah, I'd
that.
say 6-7 months.
However, we're going to want you on a softish-ish kind of diet for the first 3 months or so. So then after that, you can begin to eat a more normal diet. Now, when I say soft diet, I'm talking about fish, homemade hamburger patty, cooked vegetables, anything soft. Mashed potatoes, squash and onions,
Exactly.
cooked carrots. I mean, it's a healthy diet.
Yeah, it's not a liquid diet. You're
Yeah.
still eating. You're still eating.
Yeah.
So
So we're not talking about starving you. We're talking about you eating a healthy diet. You need to stay out of the ice cream and the cookies and all of that anyway,
yeah.
particularly if you're a type 2 diabetic.
Yeah.
So, but anyway, a healthy diet. And then when you get the finals, well, I mean, you could eat whatever you want to, but it's important to maintain a healthy diet.
It is. All right, and that is the entire snapshot of the process. And then jumping on to the next slide, these
That
are...
is more than a snapshot.
It's a quick snapshot. Okay, it's a very detailed snapshot.
It is.
Again, it always goes back to educating the patient. So yes, these are the key differentiators that we feel that really set us apart from other centers or practices that offer this procedure. Number one is that all of our surgeons are board certified. Now, as an oral surgeon, you can still practice even if you do not pass your boards. You can still be able to practice as an oral surgeon. So this is something that's super important because board certification requires so much, exams and studying and training to be able to get that board certification. So it's just something that whenever you are looking, at bios and looking at all these doctor sites and you're reading about them, it's something great to definitely look for, and you should look for it just because these surgeons are equipped to handle your situation. So should something not go perfectly as planned.
For instance,
Yes.
at Lakeland Regional Health Hospital here, you can join the staff and they give you a grace period to become board certified because different specialties have different qualifications to be able to take a board certification exam. But if you aren't board certified within some certain period of time, you cannot be on the staff at Lakeland Regional Hospital. So board certification does make a difference, and it does mean that you meet a standard of care, a standard of knowledge. So, that's important.
Yes, and being that this is a very complex and very involved procedure, that is definitely something that you should want and expect from your provider. The second is zygomatic implants. As Dr. Richards had mentioned, we place more zygomatic implants than anyone in the country. This is, again, something that's super complex, not something that an average provider will see day to day or even do day to day. Even if they do it, it might just be a few a year. So it's working in a site that most providers don't work in. So it's imperative that whoever you go to specializes in zygomatic implants. And then the third is general anesthesia. Some other places will maybe offer it under IV sedation or maybe oral sedation, where you're given either Halcyon or Valium just to calm you down. With Dr. Richards doing this for so long, and this is something that our practice excels and it has experience on, general anesthesia really is the safest way to have the procedure done. As you can imagine, on the day of surgery, there's a lot of things going on in your mouth, and so we really want to be able to have control and to be able to protect all of your airways. So it's the safest way, and it's the best sleep you'll ever get.
Yeah.
So those are the things that really set us apart from other providers. Doctor, do you have anything else you want to add before we jump to our last slide?
I think we've provided the onlookers with probably almost too much information.
I know. Alrighty.
To digest.
Yes, to digest. Yeah. It's a lot to take in. We do have many resources later on. If you think of anything else and you want to refer to a viable source for more information, we do have the New Teeth Now community page where you actually get to see patients that are currently having this procedure done, and they might be in a different phase at where they are at in their New Teeth Now journey, or maybe they're completed, and it's a nice help group. You get advice, and you're not alone. There's people that are going through this as well, and they also have a ton of tips and things like that. To help you through the journey. We also have our Facebook group, our Instagram, of course our TikTok, and then our YouTube, where you can later on view the webinars later on if maybe you wrote something down and you forgot, or you just want to jump back to it. The webinar that you see tonight will be on the YouTube channel.
Yeah.
Thank you so much for joining us and spending your evening with us.
Yep.
If you have
Thank you.
Yeah, thank you. And if you have any questions, you can always scan the QR code if you just want to start with a virtual consult first. And then after, if you're committed and you loved everything that you heard, please give us a call, get scheduled. Lisa is again on the line until later this evening, or you can just call back tomorrow. Well, I hope you have a great evening, and
Thank you.
Thank you.
Yep.
Have a good day.
Bye.